Chuck was diagnosed with COPD, emphysema. Having advanced care planning directives completed was a tremendous relief. It took a certain weight and stress away from me because these plans had already been laid out and made. He was aware of them, I was aware of them.
When you're facing a serious illness, decisions are no longer clear or black and white. Advanced care planning is a process through which patients, families, and clinicians work together to create a plan for how to approach future medical care in a way that honors a patient's goals, values, and preferences.
Advanced care planning is really important for caregivers or loved ones because it's really hard to know exactly what patients want. And having these conversations really allows them to understand what's most important to them and allows them to participate in that care together.
We know that advanced care planning doesn't happen as often or as early as needed. PACT partners with institutions to implement advanced care planning solutions for seriously ill patients.
It helps really just guide conversations and making sure that we are doing everything that we can to have this patient's wishes be carried out.
There's three big things that makes PACT different. One is that it focuses on a team approach.
Everybody who has contact with the patient can respond when the patient wants to engage in these conversations, can refer them as needed to people who can have deeper conversations, and create care plans that match those values.
The second is the focus on training.
These are really difficult conversations. You need robust training to be able to have them well. PACT really focuses on a training program that involves online modules, but also really intensive in-person small group role play with simulated patients.
Thirdly, we really focus on the process of care.
Because each hospital is very different, each clinic's very different, so we assign a mentor to each site to help gather data, review that data, to act upon it and change the process as we go.
PACT training is equipping our healthcare professionals with tools that they absolutely need to take great care of patients. It gives them tools for conversations, tools for how to navigate difficult conversations, and it also gives them tools about how to document these conversations.
It's so helpful to me when I have a PACT champion then bring back this wonderful conversation they've had with a patient to me and say, hey, this is what your patient is looking for.
It's allowed me to connect to people in a way that maybe I wouldn't have if we didn't have PACT.
PACT has definitely made me a better nurse. It's helped me be more compassionate, a better communicator with my patients, and just a stronger nurse in general.
We have so many stories from patients and their families of thank you for doing this and thank you for asking and having these conversations.
We would never have been able to handle it as comfortably and as intelligently as we were able to handle it.
Our vision is that every member of the healthcare team can help people living with a serious illness align their care with what matters most to them.
So often patients are admitted and there's so many medical things going on that the actual person within the patient sometimes is maybe one of the last considerations. I think PACT helps identify who those people are and helps kind of bring forward their voice.